Glad to be here with you tonight or today. I just wanted to share some information with you. I know you're considering some form of implant dentistry, and I wanted to help you with your decision. Of course, I'm Dr. Leonard Anglis. I'm here in Crown Point in Michigan City. My education was in dental school, was Loyola Dental School, and then I did a year residency program at University of Chicago, and I've been able to be in diplomat status in general dentistry and implant dentistry. And so I'm here with you today and try to help you make some decisions. I put this picture up here. When you come to the office, you'll see the significance of this picture because I really like the water. I've got two boats. I have one in Florida, one on Lake Michigan, and it's a very relaxing thing for me. And when we designed the office, the space that I'm in today, we did it intentionally to make it relaxing for our patients. And part of the relaxing thing is we intentionally picked out pictures of sea scenes and Hawaiian themes and Florida themes that when you look at them, you relax. They're not a stimulating picture, and so the whole office, by intention, is to help you relax. So the program is talking about changing our smile, and it doesn't seem possible, but changing our smile can change our life. I had a patient that lived across the street from my office when I had my office in Lowell, and she had some dentures, but she was so embarrassed to be outside of the home and having a meal that she never left home to have a meal. She ate her meals in the back kitchen and never left her home. So if there was a wedding, a birthday party, a birthday celebration, she was not a part of those because she was so embarrassed by her teeth. And by changing the way that the teeth fit with dental implants, she was able to go out and enjoy those things. And so in a way, her life was changed by just changing her smile, changing her ability to chew and eat. And of course, we don't get another second chance at a first impression. And so many decisions are made by what we first think about a person or think about a situation. There's been study after study that students in college, in the first 3 minutes of a class, they know how the whole year is going to go. And they write down what they think, and then they open, and it's exactly the way that the year went. And so we want to always have our best smile forward when we go forward. This is a picture of me. I was with my son in Hawaii and got my straw hat on. I'm just enjoying it, but I'm smiling and I'm showing off my smile because by intention I had worn my teeth over my lifetime, and so I personally spent a lot of time in the dental office having my mouth reconstructed so that I have a good smile. We all know about going to the doctor and maybe he's not in shape or he's got a pack of cigarettes in his pocket, and so as a dentist, I want to show what I believe in, and so I believe in this wholeheartedly. I've not had to have dental implants, but I've certainly spent hours and hours in a dental chair having dental treatment done, so I'm very empathetic about the treatment. With first impression, here's a young fellow, and here's his smile. And so, why does he look this way? What went on to cause him to have a smile like this? And what is your first impression looking at somebody like that? And I put this picture up here. My staff said I should put the x-ray up. I usually don't like to show a lot of x-rays because it took several years for me to be able to interpret what an x-ray means. And I can point to this and see this, but it's real difficult to see it. But you can see these big white things and screws that are in here. And so This poor fellow was in a horrible automobile accident. His upper jaw was broken and into 7 or 8 pieces. His lower jaw is broken. And so when the doctors put his jaws back together, his teeth didn't fit together the same way as they did before. He had other dental problems, but it was this automobile accident. And so today we have technology. He had other problems with his teeth. It wasn't just the automobile accident, but he had a lot of decay. And so we have technology today that we're able to, in one day, remove his teeth, put dental implants in, and put a new smile in. And so this, 6 hours later, after he came into the office one day, he left with a smile like this. This is actually 1 week after he had the surgery done.
Really?
Yeah. And so this is a replica of a dental implant, and it's basically a screw. And so the interesting thing about these screws is we make a small opening into the bone and we put the screw in, and over time that screw becomes bonded to the bone. We can't take it back out. We put it in, but we can't take it back out after a few weeks. And so this titanium screw goes into the bone. After it heals, then we're able to attach the top, what we call the crown, to the implant. It's the magic of this titanium and bone interaction. It was actually discovered by a physician, and he was doing a study on circulation in dog, and he attached a titanium plate to the dog's leg, and when he went to take it off, he couldn't take it back off. And so somehow this physician made the corollary, and I don't know how he did this, but from that plate on a dog to making little screws that you put in the jawbones to put teeth on. But it's an amazing thing, and it's really the foundation of what implant dentistry is. You know, a lot of celebrities, you don't think about the big fantastic smiles celebrities have on TV, but a lot of it has been helped, just like other parts of their appearance has been helped. And so dental implants are part of it, veneers are part of it, and so fortunately today a lot of these technologies are available not only to movie stars and celebrities, but to everybody. I kind of talked about transform your smile. This was just a patient we saw. We took out the remaining upper teeth, put dental implants in, and put some teeth on, and this was the text that she sent to one of our staff people, you know, about how she felt. She was on some sedatives, so, you know, she was getting, that's why she says, before I go to sleep, because the sedatives, you know, really can knock things out. But this is how people's lives are changed, and they express it to us all the time. You know, you might be having trouble with your teeth staying in place, not being able to eat, partials moving, dentures moving, difficulty eating, difficulty talking. These are all things that happen with replacements that we have for our teeth. Just like that lady that lived across the street from my dental office, you know, living in embarrassment, not being able to confidently smile. A lot of times when I have seminars like this where I give it for people, they're not smiling, and it's basically because they're trying to hide something that's a missing tooth, a black tooth, or something that, you know, they just don't want people to see. But unfortunately, we don't know that they have that problem. Are they mad? What's the matter? Are they mad at us? Are they, you know, are they not well? Why don't they smile? We just don't know. And so people are used to hiding things in their mouth. And it's interesting when we do these big cases when we change their smile, we take pictures of their smile, and people don't even remember how to smile anymore. We can't get them to smile when we take the pictures. Later on, after they have their new teeth, of course they can smile. And so we have to be careful just to make sure what we do with their teeth reflects the smile of the future, not the smile of the present. You know, many times when I'm greeting a person for the first time in the office, I'm trying to figure out, why are they here? You know, why now? Because for the most part, things go on for a long time, and then we finally see them at this point. You know, it might be a big family event coming up. Maybe there's some big change in their life, and they want to create a new you or a new them. Worried about their health. You know, it's in the magazines all the time. The interrelationship of infections in the mouth and heart disease and possibly even Alzheimer's disease related to the inflammation in the mouth. If you have questions as we go along, just go ahead and ask them. I know you're hiding back there, but if something comes up, it would be important.
I just want to ask you.
Go ahead.
So the titanium, my mother has several rods and
Yeah.
fusions in her back. It's the same type of titanium?
Yeah.
Because I did know that titanium fuses to her spine
Right.
after a number of years or whatnot.
Right.
So it's the same concept?
Same idea. Yeah, when they do that spine surgery, there's two ways that you can put bone material in between and wait for the bone to heal, or put the titanium rods in. And the titanium rods hold it there and affect the change, but then it heals and bonds
And
to
the
it.
rod's not even needed anymore, they said, once it
Right.
actually heals.
But you can't take it back out because
Right.
it's part of the bone. You know, you would
Right.
cause too much damage.
Right, okay. So that's interesting. I didn't realize it was kind of the same concept as what
A lot of the joints and that are titanium, but not like the hip joint, because titanium metal is just not strong enough to bear that much weight. And so that's still stainless steel.
Okay.
Somebody said something, you know, my biggest referral source or ally in getting people to come in are the grandkids, you know. Mom's teeth are white, dad's teeth are white, grandma's teeth are white. Grandpa, what's the matter with your teeth? Yeah. Next thing, you know, I'm seeing somebody to make a change. They've been that way their entire life, but somebody said something. Somebody said something that they loved, and so if there's some way that I could pay off these grandkids, you know, it would be a great thing, because probably once a month there's somebody just like that fitting that bill. Maybe you're getting information for somebody you love. You know you need to do something, but what is it? So we're just trying to get some information. Some people are worried about losing their teeth, and what am I going to do if I lose my teeth? I've had so many patients over the years that their mom had dentures. They figured they were going to have dentures, and so they stopped going to the dentist because they didn't want to have the dentures. But fortunately, there's so many things that are available today. I tell it to patients all the time. This time we live in is a blessing because we have so many options, but it's also a curse because it's so difficult to decide what the best thing is. And the best thing is different for every person.
Okay, Leanne, why did you choose Dr. Inglis for your treatment? He was actually a referral from a friend of mine who had major dental issues, and I saw her one day and she had a beautiful set of teeth, and I had to find out where she went, and a year later, here I am. What was your experience like with Dr. Inglis? For having every single tooth on the top of my mouth pulled, I had a pain pill one time, and that was at nighttime, and that was kind of out of fear that I was going to wake up with pain. I had no pain, all this little swelling, a little bit of bruising, but I feel my energy is better, my confidence is better, I'm happier. I wish I would have done this a long time ago. It's amazing. I mean, an awful lot, and not only just for the looks, but I had so much going on with infection that it was to the point to where I didn't know what was more important, being in pain or, you know, like hugging my mouth. Like, they were both right up there. So now being able to smile and not having infection in my mouth and being able to, you know, drink something cold or chew something without choking or whatever, it's like a new life, honest to God. Tell me about the choking. Well, when you don't have bad teeth, or you have teeth that you're afraid are gonna break, you just can't chew. And I've choked on meat before because I couldn't cut it with my teeth, or sandwiches. I couldn't eat a sandwich regularly. I had to use a fork. I had to pick everything apart. And you don't think people notice that kind of thing, but they do. And you're like, why don't you just eat a sandwich normal? Like the stupidest, smallest things that you would think, eating a bologna sandwich, you couldn't do that because you're going to be truthful about it. Having a missing tooth and putting gum in there just so you can smile, and you always got to sit just right when you're talking to somebody, because you gotta get that angle, and no one's gonna dare see that missing, cracked, black, whatever kind of tooth you have going on. It absorbs your whole life.
Would you say, Leanne, this was life changing?
Yeah. So much that I'm gonna come back and get the bottom done.
Awesome. Thank you.
There was a couple of interesting things that she had mentioned, about the choking. I never realized this, but we started finding out about this year. One of the patients that we did treatment for, his son had to do the Heimlich maneuver on him twice during Christmas, one of the Christmas meals. And so it's hard to believe that people put up with this so long. And, there's so many great solutions, why wait? Why take a chance? The other thing is, she seems to be a younger patient, and what is the age of somebody that needs this treatment? Well, we've had patients that are in their 20s have this treatment, and we've had patients in their 90s have this dental treatment. So if you have the need for this kind of treatment, age is not related. And sometimes people who are, let's say, 70 or 80 say, well, if I was 50, I would do this right away. And then they wait another 5 or 10 years, and they suffer with the problems, and finally they do it. But then the amount or the fraction of their life is so diminished that they could have been enjoying the smile and the ability to chew. Why wait? Do it now while you can. We showed the picture before about the dental implant. It's the metal thing that goes into the bone. Then we can. Dental implants are like the things that we put in the wall to hang up drapes and things like that. You screw it into the wall, and it's got threads on the inside, and we can make all kinds of attachments to the implants. And so this is just a replica of the idea that we have something that screws into the implant, and then the crown fits onto the top of it. We can cement it on, or sometimes we screw the tooth onto the implant. The neat thing about the implant is if later on we need to change something, we just take the screws back out, and we have the implant in the bone. We can put new stuff from the implant up. And so it's amazing technology that we're able to do the things like that. And once the implant's in place, it seems strange, but we can do all those things without numbing things up. There's no sensation of a pain or anything like that. So implants stop bone loss. Once you probably have seen somebody or know somebody that's had a lot of teeth removed, and what happens? Their face shrinks in, they get more wrinkles, and that's because of bone loss. The bone was there to hold the teeth. You take the teeth away, the bone shrinks away, and the face changes. The interesting thing is implants replicate the same movement of teeth, and so if we can put the implants in soon enough, they're going to keep that bone there and keep it from shrinking away. Missing teeth, we lose our ability to chew. A lot of patients tell me, my teeth are getting dull, I can't chew any. Well, really, they don't have enough support, bone support, tooth support, and so the muscles know they can't put as much chewing force on it. We put dental implants back in, the muscles know that we can chew hard again, and so people can chew well with the dental implants when they're missing the teeth. This is just kind of a quick dental information thing. It's a way of replacing a missing one tooth. Say we're missing one tooth. We can have a partial denture, or a fixed bridge or a dental implant. So the partial is a plastic appliance like this or a metal appliance, and it clips to place, and it covers usually on the top the whole roof of the mouth, and on the bottom it covers the inside and it goes along the back teeth. And so for some people that's impossible to get used to because it's covering so much of the roof of the mouth. And it moves, and it's difficult to keep things clean. This is a partial for somebody that's missing a lot of back teeth, and so we have these clips. You probably have seen somebody where they have like a little metal wire on that. That's a partial, and it clips onto the remaining teeth. It can wear the remaining teeth. It can cause extra decay there. And so if we can do other things other than a partial, that's what we want to do. And these are dentures, and it's basically something that rests on the whole mouth. And if people have both upper and lower dentures, they usually do better with the upper denture because it covers the whole roof of the mouth. There's suction, and it kind of stays in place, whereas the bottom never stays in place because there's the strong muscles of our lip, the strong muscles of our tongue, and anytime we talk or eat, or the lower denture is moving. And that's why you probably have seen somebody or know somebody, or maybe it's you that has the lower denture in their pocket or in a drawer. They just can't wear it. You know, I'll be in a fancy restaurant and I'll see somebody chewing, and I know that they have dentures, but they're not wearing it. They're trying to chew a steak just with their gums. And so it's because the dentures, they look good, and so if you have a bad appearance, you know, they're going to fix that. But usually what happens is you trade one set of problems in for a new set of problems that's worse than the first. This is a replica of a bridge, and it's when I graduated from dental school, that's how we replaced a single tooth. We reduce a tooth on either side of the space, and then we'd make this 3-tooth thing that's cemented onto the 2 teeth. And that's a great way to replace it, except 3 teeth are hooked together, and if something would happen where one of the crowns would come loose of one of the teeth, usually by the time we figure out it's loose, another tooth is decayed. That's why I always say, if we're replacing a single tooth with a dental implant, God forbid something would happen and we'd lose that implant, we're no worse off than we were than when we started. But with a bridge, if something happens, it's usually we're worse off than we were to begin with. And again, of course, the dental implant is just there. It's pretty much an artificial replacement of the root of the tooth. That's what the implant is, and the crown is attached to it. And we can replace a single tooth with it, or in this case, we can replace four teeth with sometimes 2 implants. But it's interesting though, if there's 2 teeth right next to one another, we have to have 2 implants right next to each other, because we can't have one tooth hanging over the side, and when we chew it would be putting too much pressure on the one implant. But if we have more teeth missing, we could spread them apart and attach more of it. The testimonial of the one patient you saw, or some of the other big changes, the interesting thing is all 12, well, we're replacing 12 teeth are replaced just with 4 dental implants. And that's this technology. Replaced the 4 dental implants in different locations, and then the 12 teeth are attached to it. And so for 2 teeth we need 2 dental implants, but 12 teeth we only need 4 dental implants. And the amazing thing is when we do it in this fashion, where we're replacing all the teeth, we can put the dental implants in and put the teeth on that same day. But if we're replacing 2 teeth with dental implants, usually we have to wait a little bit before we can put the teeth on.
Is that because they're right next to each other?
Yeah, and it's usually because when we have implants and they're all in a line, there isn't much stability to it, you know, and so if we put teeth on it, we could tip it or shift it, but in the arch with the curve, You can't move it. If you bite on this thing, it's with it, and it's a very stable situation. And it's because of this technology, we're able to spread the implants out, make them as far apart as we can, and that's where the stability is. You know, you had mentioned earlier about the rod like fixed the neck. Well, that's fixated in one place, and then that allows everything to heal. And the same thing with this. The teeth actually aid the implants in healing. So I put this picture here, and a lot of, it seems strange, but a lot of the more forward ideas with dental implants and teeth were created in different countries. And so this one picture is this Malo Clinic is in Lisbon, Portugal. The doctor that developed this technique, his office is in Portugal. And when I decided I wanted to study it rather than just read books or go to somebody that may have some knowledge about it, I decided I'd go to the doctor that did the initial research. And so that's why I have this picture, is because I was in Portugal. And actually I've been there like 7 or 8 times. And I've been to Barcelona a couple times to study different ideas about the dental implants. And I go to different centers in the United States. And so one of our biggest strengths in this office is I've gone over the world, got this information, put it together. We've created our own method, and we're able to offer it here in Indiana. You don't have to go to Lisbon. Actually, I really believe that because of interaction with my staff and all the things, we have a better technique than they do in the centers that did the initial research. I know for a fact that we can do it a lot more efficiently than they can. Patients that go in Portugal, they'll go first thing in the morning, have the surgery done, and they might not leave to go home until 9 o'clock at night. Usually our patients are here for about 3 hours to have one arch done, or if they're having both upper and lower, it could be 5 or 6 hours. So we were able to streamline the procedure, and because nobody wants to hang around here anymore. And you know, we don't want to have to use more medications and things like that. We'd rather get things done, get people back home where they want to be. The techniques, all different kinds of smile problems we can fix with these techniques. And so this young woman, her teeth were in bad alignment. She had a couple teeth that were up in her bone that never erupted, and she showed so much gum tissue. And so a week later, after we had the procedure, she was able to have a smile again. Mm-hmm. I'm going to just show this picture. This is her mom, and we're going to have a dual testimonial here in a minute. But there's this missing tooth on the bottom, and don't be distracted by that too much, because in this picture, she's got the big smile on the top, but she's still missing that bottom tooth. If we had the picture testimonial today, that would be gone, because we replaced that tooth. But in any case, here, let's just kind of.
Go ahead. Give my mom a kiss.
Oh, do my kiss. That's sweet. That was nice. Okay.
All right, Tiffany, you love your teeth?
Oh, yeah.
Yeah? Why don't you tell the camera and all the doctors that are going to see this video why you chose Dr. Inglis?
I love it.
You love him? Mother, why don't you tell everybody why you guys chose Dr. Inglis?
There was a promotional brochure that came out, and originally I wanted my teeth done, but I couldn't do it at the time. And Tiffany complained several times about the kids making fun and how she chewed and how her ragged her teeth were and everything. So I sacrificed and decided to get her done first. Well, when she got hers done, she told me, she said, Mama, that wasn't bad. She said, I remember the doctor going, snap, 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 and that was it. And she said, now, Mama, look how pretty I look. And she does. She is beautiful. Now,
Oh, my mom.
Tiffany, are you satisfied? Oh, yeah. That's what it was And I'm very pleased, very pleased. I love it.
Tiffany, what do you think of mommy's teeth?
Sexy. I don't know if that's appropriate, but I do feel good. I feel good.
And Melba, how do you feel like this has changed Tiffany's life?
Tiffany has always been a bubbly person and outgoing, but now she's just above and beyond. She smiles, she has more personality than she ever had before, and she really loves Dr. England. She's very pleased with him, very pleased.
And Tiffany, how do you think it's changed Mom's smile in her life?
Mm-hmm.
How do you think that Mom getting her teeth done, how did that change her life?
Tiffany, blood learning. What do you mean? I don't quite understand that. Do I look better? Do I? You know, I like that. I like that. Okay, then.
Do you guys have
Make her
any-
extra nervous just being on the video.
I highly recommend it.
She's a
And
beautiful
it's
smile.
now,
Really is, yeah.
I couldn't have asked for better patience and understanding with Tiffany, even though she's Down syndrome, and limited with a lot of things. She's been treated liberally.
She's like family.
All right, that was perfect. Thank you.
You might be worried, you know, am I going to be able to take care of my new teeth? And I can just tell you that Tiffany can take care of her teeth. You know, she keeps everything clean and perfectly healthy, and so I don't want you to worry about that. Actually, we've developed a technique or a way for you to maintain your teeth. There isn't a universal protocol for you doing home care, but we've developed one for you, and we're going to teach you to do that. And actually, patients that have treatment like this, we provide the first year of cleaning so that we can be sure that you're going to be able to take care of it and do it the way that you're supposed to be and protect your investment. So in any case, this fellow has a smile. He didn't have a smile when he came to the office. He went to a corporate dental office and had his upper teeth taken out and most of his lower teeth taken out. And he had an upper denture and a lower, what we call a partial, that clipped onto the bottom. He wore neither of them, you know, and so he went without top teeth and without much bottom teeth. And so here he is with a smile again. I don't know if this is true, but I suspect he would have probably continued on the way he was, except his girlfriend got tired of looking at him without teeth, and so he had to come in and get some new teeth. This fellow, he was losing his top teeth. He didn't know what to do, and so we gave him a way of replacing his teeth in a fixed fashion that not only could work real good, but, you know, give him his smile back again. We like to call it our method. We developed it, you know, we used information I got from Lisbon and Barcelona and Yorba Linda in California, and we've combined it into one technique. It's kind of mixed up the best things from all those things, and we come out with something that's even better. You know, and whatever we do is, you're never going to be without teeth. We always find a way for you to have teeth. A lot of times when we place implants, we place them straight up and down, and if we're replacing just a few teeth, we try to put them right underneath the teeth. But if we're doing the technique where we're taking the teeth out and put dental implants in, you can see these implants are kind of like at weird angles. And why are we doing that? And there's a couple reasons why. First, it's to spread the implants out, make them further apart so there's more stability. The second is we try and find the most dense and hardest bone to put the implants in. And so on the bottom, the reason why we're angling them is that there's a nerve that runs through our lower jaw. So if you've had dental treatment on the bottom, the doctor gives you a shot way in the back, and what does he do? He asks, is your lip numb yet? And that's because this nerve that runs through here and goes up to all the teeth comes out of the bone right here and goes to our lip. So if we placed an implant back here and there wasn't enough bone, we'd run into that nerve and it would be lights out for the lip. So nobody wants that. So what we do is we start the implant way as far back as we can, and we miss where that nerve is. But we're able to spread it as far back as we can. And on the top, it's a similar thing, but there's sinuses are in the back. And what we do is we miss the sinuses and miss the real soft bone in the back and go into the real dense bone in the front. And then we attach the teeth to those implants. Talked about that. You know, of course, missing teeth, we can't chew we know what we need to be eating. You know, we go to Europe, and I was just in Italy and Spain. Everybody's so slim and trim, and they're eating the whole foods, you know, no processed foods. And so to eat the whole foods, you know, you need it's the crunchy, hard things. It's the hard bread. It's all the vegetables, and we can't do that if we're missing our teeth. Am I a candidate for dental implants? And basically, if a person can, like, if you cut yourself and you could heal, you probably can have dental implants. If people have bad metabolic problems like uncontrolled diabetes or thyroid problems, probably not. But everybody else, yes. And like I said, it's not dependent on age. We've had, I think our oldest patient was like 94 that had dental implants. And usually we can find some way to finance it, or that. In his case, it was an interesting thing. He had a life insurance policy, and they gave up waiting for him to pass to write the benefit. And so they sent him a check for his life insurance, and he saw he had this money, and he knew that he wanted it. You know, we have patients that are older like that, and they'll have a spouse in a nursing home, and they see what happens when people lose their teeth in the nursing home or can't chew or eat because, you know, they can't remember what to do. And so they want the dental implants to do that. My mom had Alzheimer's disease, and she had lost a lot of her teeth early on in her life because of periodontal disease. And I was able to place dental implants, and for the rest of her life, I didn't have to worry about where her teeth were. And when she wasn't thinking the way she should, as long as she remembered she wanted to eat, she could eat. You know, I didn't have to worry about that. And, you know, for me, that was such a blessing. Because there's so many times, you know, people have removable things and they'll hide it someplace or put it someplace. And I'm forever, like, remaking those because they've hid them someplace. The process, just like Melba said, you know, she came in, she had a broken tooth. I was heading out of the country. We took impressions that day, made the teeth. We did the surgery the next day, and she had her teeth. We can't always do it like that, but, you know, we'll do whatever it takes to make things like that happen. As soon as I have a vision of what it is, we're not going to make people wait a long time to have it. You know, it was just like the other day. No front teeth. We got some impressions, and real soon after that we had front teeth. So, you know, it's just the way that we work. We just don't want people to dwell on it. They made the decision. Let's get going. And so, to place a single implant, we schedule about an hour. And to be honest, you know, the majority of the time we're just like waiting for things to be numb. And, you know, like 5-10 minutes it takes to place the dental implant. And then the rest of the time is telling you what to do when you go home. And so it takes a real short period of time to place a dental implant. And for patients that have all their teeth taken out on the top, put the dental implants in, put the teeth on, that takes about 3 hours. They have upper and lower teeth, about 5 or 6 hours. And we give patients pills that help numb up the brain some when we do it. And we recommend doing that because after we get going, they take a nap. It's just like you would take a nap in the car on a long trip. Oh my gosh, we're almost there. You know, and it's the same thing when the patients take those pills. And so we make it so that the time goes as quickly as you can. We try and make things seem like they're going quicker. We have earphones, noise-canceling earphones, and music, and everything we can do to make things relaxing and go as quickly as possible. Does the procedure hurt? We do everything we can to numb things up. And the truth be known is that I have doctors that send me patients that they can't numb up. And so we have ways and techniques for numbing things up. So I'm sure that, when a patient is ready to have their dental implants done, we're going to be able to make things comfortable. We're going to be able to give you the pills. Or sometimes we have patients that have stayed away from the dentist, stayed away from me because of their fear of the dentist. And they can't figure out exactly how they got that fear, but it's real, and there's nothing that I could say or do to change it. And so we have anesthesiologists that come into the office, put patients to sleep. We do the procedure while they're asleep. So it's a customized thing that we make for every person. Not every person needs to be put to sleep. Not every person even wants to have the pills to numb up their brain. They just numb it up and let's get going. So it's whatever's best. I put this picture up here, and it's my wife Nancy and myself and my good friends from Manhattan, New York, the Goldbergs. Dr. Goldberg, he's a dentist in New York, and his wife is an office manager. It's probably kind of like similar for Nancy and me. In between us is Sona, their friend from Manhattan, New York, and she needed to have 8 teeth taken out on the top, 4 dental implants, and her teeth replaced. The interesting thing is she had it done that morning, and she's out at the restaurant with us that night. And she's not only just, she had the room at the Hilton Garden Inn. Am I going to stay there by myself? No, I'm going out to the restaurant with you people. So, but she had dinner that night. We make it so people can eat. And when we do this whole mouth treatment, we tell them if they can cut it with a fork, they can eat it. So here she's having the pad thai noodles, and she had those ribs that they cook for, 10 hours, and they're real soft. The only thing she didn't have that the rest of us had was, the wine, because, her stomach was full of antibiotics and steroids and things like that. The other interesting part about that story is, next morning, Michael, he wants to go fishing with me in Lake Michigan. Lori wants to go with Nancy to Chicago to go shopping. Does Sona want to stay in the Hilton Garden Inn by herself? No. So she goes to Chicago with the ladies, and she had one of those pedometers on. And the next day after she had that surgery, she walked 5 miles, in Chicago. So not every patient that we have is like Sona, but more are like Sona than they are the ones that have to take a lot of pain medicine. And it has a lot to do with the nature of the surgery and the way that the gum tissue is taken care of. Because the gum tissue in our mouth is the sensitive part. It's got so many nerves in it. If we don't address that properly, we're going to have a lot of discomfort. The bone, there's not a lot of nerves in the bone. So, and in her case, her teeth were all supported by the implants. They weren't resting on the gum tissue. And that's why she's comfortable. Implants can be expensive, but in the long run, because we do it in a way that it's going to last for a long time, we don't have to be doing and redoing and redoing things again. One of the things I see so often is that patients will, and their doctors will develop a treatment plan that is less expensive, but it doesn't address the needs. I have so many patients that come in, they have 2 dental implants and the teeth snap onto it, but they still have pain in the jawbone in the back where the denture. They're not happy, the thing moves, stuff gets caught underneath it. So it's better just to do it the right way the first time. There's all kinds of plans to help with it, flex plans. There's tax deductions that are available. Financing is available. this thing with the tax deduction. I don't know exactly how to do this, but I went online, and for medical expenses that are grouped up in 1 year, there's a tax deduction for it. And IRS topic 502. That's all I know. But there is a way that, and it's not only that. I've even heard of, somebody's got to exercise and they have a swimming pool, that what the doctor prescribed, and they're able to take it as a tax deduction. And it's withheld the courts and everything like that. So just read that, talk to your tax advisor. That's all I know. And then we'll help you take care of the dental implants. It's recommended, that the teeth after having dental implants are cleaned every 3 to 6 months. And we'll show you every single thing that you need. We'll provide the education. We have these little packages of what toothbrush, what toothpaste, what mouth rinse. We give it. Just when you run out of this, just go to the Walgreens and get exactly the same thing, because there's been a lot of research by us to pick the best thing. And one of the small things that we did with picking the toothpaste, this is just one example, is that in a lot of cosmetics and toothpaste and that, they put these little plastic beads in it to make it feel soft. And the trouble is we think those little beads get up underneath the gum tissue and go down on the implant and cause the implant to be lost. So we find a toothpaste that doesn't have those. We have custom-made materials. There's materials that are used in Europe, like these chlorhexidine gels. You can go to any pharmacy and get it. And actually, we were in a restaurant in Barcelona, Spain, and they had a little package of chlorhexidine gel in the bathroom. But you can't buy it in the United States. I have to think that it's because of the FDA, and it just would cost too much, and people couldn't make enough to do it. It's not worthwhile. And so we have those custom made by the pharmacy.
What is it for?
It's just for aided healing. It's an antimicrobial, the chlorhexidine, but if we give you the mouth rinse, which is available, it makes your mouth feel awful, it tastes awful, and it stains your teeth and makes them black. But if we put in this gel, you can put it right on the side. It doesn't affect anything, and it works better because it sticks to the spot. But the same thing, there's healing things. There's hyaluronic acid. I'm falling asleep on the couch, and there's some kind of makeup or something with hyaluronic acid. I go, oh yeah, I heard about that in Europe. They're putting it in cosmetics, but you can't get it in a gel to use in your mouth. So we make those things for our patients. Why here? Why now? We provide customized, individualized treatment. We provide. You would take everything about the problem into account, and then we find the best way to take care of it. Best level of service, 5-star plus. We find things. We have. You come in for treatment. We find out what kind of smoothie you want. Because you're numbed up and you're there for an hour or two. You need a little snack. We'll have that for you. We'll have earphones so that you can listen to the music that you like. And my staff has been with me for a long, long time, and so it was interesting. There was an attorney that had been away from the office for 9 years, and he came back. And he was so surprised that everybody recognized him. He recognized everybody, and it was like he had never been away. And not only that, the comfort of being with the same people, but we're able to synchronize our treatment. We'll work together and provide it in the best way. And when we do bigger procedures, bigger surgery, everybody's working on the thing at the same time. And it's hard to understand how that improves the quality of what we can do, but it does. We have people looking over, maybe you need to move it over like this. And so it's just a great way to work. And our staff is trained on all levels of holistic medicine and dentistry. We talk about nutrition at our meeting. We have a meeting on Tuesday morning in this room, and we talk about those things. We talk about things that affect our health, and we know about it. And they can transfer that information to our patients. We have customized formulations. You'll be part of our family. We'll take care. Once you have big treatment done, you are part of our family. We have to take care of you for the rest of your life. You are our family. I travel around the world. The most current, relevant treatment is performed here. It's all here, and we do it all here. You don't have to go over here and over here. It's all done in this one office. We're very efficient with your time. Once we determine what it is, we find how to compact all the steps in as small a package as we can to get it done as quickly as we can. We have the most current technology. We have high-tech scanning machines, 3D imaging. And when we propose treatment, it's the complete treatment. Whatever the fee is, it's for whatever it is that we're doing, we set the fee, and if something else comes up and we have to do something different, it's my dollar. I take care of it. You don't have to worry about it. Most current technology, human touch, and we specialize in this kind of treatment. There's not a specialty, official specialty for this, but this is what we do. And the vote is in. Almost 50 dentists and their families have been treated in this office, and so that says something. It's the doctors that we work with. We see them all the time. We see their families. We see their mother-in-laws, their children. So we're there to help people that really recognize what we do, and we're there to help them. I'm going to just do one more testimony. Is that okay with you if I do one more? This is kind of interesting.
All right, Mick, you just want to tell us a little bit about your story and tell us why you chose Dr. Inglis.
I had researched this for about 2 years. I had been declared choice, and then I came here, I researched Dr. Inglis, and just the people here were so much better than going declared choice for me. It made me more comfortable here. I had a lot of anxiety issues I've been through. I was going to do dentures at one point. I was actually in the chair, and they were going to put me under, and I walked out of the doctor's office. I was just because of my panic attack and that kind of thing. And when I came here, it felt right. It was comfortable. The people here made me feel comfortable. So, you get my teeth were right. I maybe had 2 teeth left. The pain, I was tired of not being able to eat what I wanted, not just the pain that I was going through. I did it for functionality more so than, it's a great smile. I appreciate it, but that wasn't why I did it. I didn't want to hurt no more, and I just wanted to be able to eat what I wanted and not have to worry about it. I didn't want to be embarrassed to talk to people. So for me, it was all about functionality.
Good. How did the procedure go for you?
Great. I mean, for me, the pain was minimal. I mean, I took maybe the Narco or Viking, whatever it was, the first night, and then maybe 2 nights after that, pain was during the day. I didn't take any of that. A little Motrin maybe, but pain was relatively minimal for me. So, you just got to eat right, listen to what they say, and eat the foods they say, and, everything's usually goes smooth.
How do you like the outcome?
Outstanding, again. I ain't any better about it, but I mean, it's just not great. I'm happy. For me, it became, now it's like, I didn't even think about it. I just live life. I'm not self-conscious. I guess for me, my perspective is, I don't go to the mirror and say, hey, my smile's great. I brush my teeth, I take care of it, make sure they're clean and everything, but just being able to talk to people without being embarrassed.
again?
Oh, absolutely. I'd absolutely recommend not going to listen to the staff. It's been great. My entire experience here has been wonderful. So,
Awesome. Thank you.
Well, kind of one thing that he didn't talk about, but you know, he alluded to it, was how nervous he was in the dentist. You know, he was in I think an oral surgeon's office going to be put to sleep to have, and then he left. And we knew all about that, and so we had scheduled him to have the anesthesia come into the office, but it's hard to tell because, you know, his face is slimmer because he's lost like 100 pounds, but he's still a really big guy. And the day of the surgery, the anesthesia decided that they weren't going to do it because they thought it was too risky. And that's happening in a lot of places. You know, you're a big person, you got to go to the hospital and they're going to take care of you. So, but at that point, he was so comfortable being in our office, and with what we did is we gave him the pills that numbed his brain up a little bit, and we did the procedure. You know, and he did so great, and so it was kind of an interesting thing. You know, that, you know, he had been so scared, but you know, because of the way we treated him, he was able to relax enough to have the treatment done. That was to me, that was you know, the most amazing part. And so, looking forward, you know, you've got these problems. You know, you need something done. I can't. You there, me here. I can't tell you what it is, but you know, if you wanted to come in, we have a complimentary consultation. We'll take a film and tell you exactly what it is that you need, how long it'll take, how much it'll cost, and you know, we're just kind of like waiting for you to call. The only thing that you have to do is call, and then as soon as you call, we'll take over everything. And I tell my patients all the time, I said, you know, you make the call and I'll worry about everything. You can stop worrying because I'm thinking all the time about your care and trying to figure out what the best thing is for the next move. So just make that phone call and we'll help you find a solution.